Question 1. A multinational healthcare organization is planning to implement a global compliance program. The organization operates in various countries, each with its own set of healthcare regulations and cultural norms. The compliance officer is tasked with ensuring that the program is effective across all regions. Which of the following approaches would best address the challenges of implementing a global compliance program in such a diverse environment? A. Develop a uniform compliance program based on the organization's home country regulations and apply it globally. B. Create region-specific compliance programs tailored to each country's regulations and cultural practices, without a unifying global framework. C. Establish a global compliance framework that sets overarching principles, while allowing for regional adaptations to address local laws and cultural differences. D. Rely on local management teams to develop and enforce compliance programs independently, ensuring they meet local requirements. Correct answer. C. Establish a global compliance framework that sets overarching principles, while allowing for regional adaptations to address local laws and cultural differences. Explanation. Implementing a global compliance program requires a balance between standardization and localization. A global framework provides consistent principles and expectations, promoting a unified compliance culture. Allowing regional adaptations ensures that local laws, regulations, and cultural nuances are appropriately addressed. This approach aligns with best practices in global compliance management, facilitating both consistency and flexibility. Question 2. Under the U.S. Foreign Corrupt Practices Act, FCPA, which of the following scenarios would most likely constitute a violation? A. Providing a modest meal to a foreign healthcare official during a business meeting. B. Offering a charitable donation to a hospital in a foreign country without any expectation of business advantage. C. Paying a foreign government official to expedite the approval of a medical device with the intent of securing a business contract. D. Reimbursing travel expenses for a foreign healthcare provider to attend a legitimate medical conference. Correct answer. C. Paying a foreign government official to expedite the approval of a medical device with the intent of securing a business contract. Explanation. The FCPA prohibits offering, paying, or promising anything of value to foreign officials to influence their actions or secure an improper business advantage. Paying a government official to expedite approval processes directly violates the anti-bribery provisions of the FCPA. While certain payments, like modest meals or legitimate travel reimbursements, may be permissible under specific circumstances, any payment intended to influence official actions for business gain is prohibited. Question 3. A healthcare organization discovers that one of its vendors has been using substandard materials in the production of medical devices, potentially compromising patient safety. The compliance officer must decide on the appropriate course of action. Which of the following steps should be taken first? A. Immediately terminate the contract with the vendor and notify all regulatory authorities. B. Conduct an internal investigation to assess the extent of the issue and gather relevant facts. C. Issue a public statement acknowledging the issue and outlining corrective measures. D. Suspend all business activities with the vendor until further notice. Correct answer. B. Conduct an internal investigation to assess the extent of the issue and gather relevant facts. Explanation. Upon discovering potential compliance violations, the first step is to conduct a thorough internal investigation to understand the scope and impact of the issue. This aligns with best practices in compliance management, allowing the organization to make informed decisions about subsequent actions, such as reporting to authorities, terminating contracts, or issuing public statements. Premature actions without a complete understanding of the situation could lead to unintended consequences. Question 4. Which of the following best describes the primary purpose of the U.S. Sunshine Act, Open Payments Program, in the context of healthcare compliance? A. To prevent healthcare providers from receiving any form of compensation from pharmaceutical companies. B. To mandate the disclosure of financial relationships between healthcare providers and industry manufacturers, promoting transparency. C. To regulate the pricing of pharmaceutical products and medical devices in the healthcare market. D. To enforce penalties on healthcare providers who fail to report their income accurately to the IRS. Correct answer. B. To mandate the disclosure of financial relationships between healthcare providers and industry manufacturers, promoting transparency. Explanation. The Sunshine Act requires manufacturers of drugs, medical devices, and biologicals to report payments and other transfers of value to physicians and teaching hospitals. The primary goal is to increase transparency in financial relationships, helping to identify potential conflicts of interest, and ensuring that patient care decisions are not unduly influenced by industry incentives. Question 5. Scenario. Dr. Maria Lopez, a renowned cardiologist, is invited by a pharmaceutical company to attend an international medical conference. The company offers to cover her travel, accommodation, and a daily stipend. In return, they request that she give a presentation endorsing their new cardiac drug, which is still under clinical trial and not yet approved by regulatory authorities. As a compliance officer, what is the most appropriate advice to give Dr. Lopez regarding this invitation? A. Accept the invitation, as attending conferences is part of professional development. B. Decline the invitation, as endorsing an unapproved drug poses significant compliance risks. C. Accept the invitation but refrain from discussing the unapproved drug during the presentation. D. Negotiate with the company to receive the stipend without giving the presentation. Correct answer. B. Decline the invitation, as endorsing an unapproved drug poses significant compliance risks. Explanation. Endorsing an unapproved drug can be considered off-label promotion, which is prohibited under various regulations, including FDA guidelines. Accepting such an invitation could implicate Dr. Lopez and the sponsoring company in non-compliant activities, potentially leading to legal and reputational consequences. The safest course of action is to decline the invitation to avoid any appearance of impropriety or regulatory violations. Question 6. A multinational healthcare organization is evaluating its compliance program's effectiveness. Which of the following elements is least indicative of an effective compliance program, as per the U.S. Federal Sentencing Guidelines? A. Regularly updated policies and procedures. B. Appointment of a compliance officer with sufficient authority. C. Implementation of a reward system for employees who report violations. D. Effective training and education programs for all employees. Correct answer. C. Implementation of a reward system for employees who report violations. Explanation. The U.S. Federal Sentencing Guidelines outline 7 elements of an effective compliance program, which include standards and procedures, oversight, education and training, monitoring and auditing, reporting mechanisms, enforcement and discipline, and response and prevention. While encouraging reporting is essential, implementing a reward system is not a standard element and may lead to unintended consequences, such as false reporting. Question 7. Under the General Data Protection Regulation, GDPR, which of the following scenarios would most likely require obtaining explicit consent from the data subject? A. Processing data necessary for the performance of a contract. B. Processing data to comply with a legal obligation. C. Processing special categories of personal data, such as health information, for research purposes. D. Processing data for the legitimate interests of the data controller. Correct answer. C. Processing special categories of personal data such as health information for research purposes. Explanation. Under GDPR, processing special categories of personal data, including health information, generally requires explicit consent from the data subject unless specific conditions are met, such as processing necessary for scientific research purposes with appropriate safeguards. Question 8. A healthcare organization is conducting a risk assessment to identify potential compliance risks. Which of the following is not typically considered a compliance risk category? A. Legal risk. B. Operational risk. C. Reputational risk. D. Technological risk. Correct answer. D. Technological risk. Explanation. Compliance risk categories typically include legal, operational, and reputational risks. Technological risk, while important, is generally considered under operational risk or as a separate category in enterprise risk management frameworks. Question 9. Which of the following actions would most likely violate the Anti-Kickback Statute, AKS, in the United States? A. Providing free educational materials to healthcare providers. B. Offering discounts to providers for bulk purchases of medical supplies. C. Paying a physician for each patient they refer to a specific laboratory. D. Sponsoring a medical conference attended by healthcare professionals. Correct answer. C. Paying a physician for each patient they refer to a specific laboratory. Explanation. The AKS prohibits offering, paying, soliciting, or receiving remuneration to induce or reward referrals for services reimbursable by federal healthcare programs. Paying a physician per referral constitutes a clear violation. Question 10. In the context of healthcare compliance, what is the primary purpose of a corporate integrity agreement, CIA? A. To serve as a voluntary commitment to ethical practices. B. To outline the terms of a merger between two healthcare entities. C. To settle allegations of non-compliance and establish obligations for future compliance. D. To provide a framework for international healthcare collaborations. Correct answer. C. To settle allegations of non-compliance and establish obligations for future compliance. Explanation. A CIA is a document that outlines the obligations a healthcare organization agrees to as part of a settlement with the Office of Inspector General, OIG, to resolve allegations of non-compliance with federal healthcare program requirements. Question 11. Scenario. Dr. Thompson, a renowned cardiologist, is offered an all-expenses-paid trip by a pharmaceutical company to attend a conference in the Bahamas, where the company will present its new heart medication. The company expects Dr. Thompson to prescribe this medication to his patients. What is the most appropriate action for Dr. Thompson to take to remain compliant with healthcare regulations? A. Accept the trip and prescribe the medication as expected. B. Accept the trip, but make prescribing decisions independently. C. Decline the trip to avoid any appearance of impropriety. D. Accept the trip and disclose it to his patients. Correct answer. C. Decline the trip to avoid any appearance of impropriety. Explanation. Accepting such incentives can violate anti-kickback laws and create conflicts of interest. Declining the offer helps maintain professional integrity and compliance with regulations. Question 12. Under the Health Insurance Portability and Accountability Act, HIPAA, which of the following is considered a breach of protected health information, FI? A. A nurse accesses her own medical records using the hospital's electronic system. B. A physician discusses a patient's case with another physician involved in the patient's care. C. A billing clerk accidentally sends a patient's information to the wrong insurance company. D. A hospital shares patient data with a public health authority for disease tracking. Correct answer. C. A billing clerk accidentally sends a patient's information to the wrong insurance company. Explanation. Accidental disclosures of FI to unauthorized entities are considered breaches under HIPAA and require appropriate reporting and mitigation. Question 13. Which of the following best describes the primary function of an ethics committee in a healthcare organization? A. To oversee financial audits. B. To develop marketing strategies. C. To address ethical dilemmas and provide guidance on ethical practices. D. To manage employee benefits. Correct answer. C. To address ethical dilemmas and provide guidance on ethical practices. Explanation. Ethics committees are responsible for reviewing and advising on ethical issues within healthcare organizations, ensuring decisions align with ethical standards and patient rights. Question 14. In the context of the Foreign Corrupt Practices Act, FCPA, which of the following actions is most likely to be considered a violation? A. Providing a modest meal to a foreign healthcare official during a business meeting. B. Offering a scholarship to a foreign medical student based on merit. C. Paying a foreign official to expedite the approval of a medical device. D. Donating medical supplies to a foreign hospital. Correct answer. C. Paying a foreign official to expedite the approval of a medical device. Explanation. The FCPA prohibits offering anything of value to foreign officials to influence their actions. Paying to expedite approvals constitutes a bribe and is a clear violation. Question 15. Which of the following best exemplifies a conflict of interest in a healthcare setting? A. A physician conducting research funded by a government grant. B. A hospital administrator owning shares in a medical supply company that contracts with the hospital. C. A nurse volunteering at a free clinic on weekends. D. A medical student shadowing different departments. Correct answer. B. A hospital administrator owning shares in a medical supply company that contracts with the hospital. Explanation. Ownership interests in companies that do business with one's employer can create conflicts between personal financial interests and professional responsibilities. Question 16. In developing a third-party risk management program, which of the following actions is most critical during the onboarding phase of a healthcare distributor in a high-risk market? A. Rely on verbal assurances that no bribes will be paid. B. Require the distributor to sign a code of conduct only after onboarding. C. Conduct robust due diligence and sanction screening before engagement. D. Offer incentives to speed up contract signing in compliance with local practices. Correct answer. C. Conduct robust due diligence and sanction screening before engagement. Explanation. Third-party due diligence is a cornerstone of anti-corruption compliance, particularly under laws like the FCPA and UK Bribery Act. Sanction screening, e.g., OFAC, UN, ensures the distributor is not barred from global transactions. Verbal assurances or post-onboarding agreements are insufficient and may expose the organization to enforcement actions. Question 17. Which of the following best represents an acceptable use of patient data under the General Data Protection Regulation, GDPR, without explicit consent? A. Conducting a medical study that uses de-identified data. B. Selling data to a third party for pharmaceutical marketing. C. Using personal health data for targeted advertising. D. Transferring health records cross-border without safeguards. Correct answer. A. Conducting a medical study that uses de-identified data. Explanation. Under GDPR, de-identified or anonymized data is no longer considered personal data and can be used for research without explicit consent. However, personal data used for commercial or marketing purposes still requires valid consent or a lawful basis. Cross-border transfers must comply with GDPR safeguards, e.g., standard contractual clauses. Question 18. Mr. Camel, a compliance officer for a global CRO, receives a whistleblower report alleging that one of the company's overseas research sites failed to obtain informed consent from trial participants. The site manager insists the patients verbally agreed and were aware of the trial risks. What should Mr. Camel do first? A. Close the complaint, as verbal agreement constitutes implied consent. B. Immediately notify all local regulatory authorities and issue press releases. C. Launch an internal investigation to confirm facts and assess documentation. D. Remove the site manager and terminate the study. Correct answer. C. Launch an internal investigation to confirm facts and assess documentation. Explanation. Internal investigation ensures a thorough, fair, and legally compliant response. GCP requires informed consent to be documented. Verbal consent alone does not meet compliance standards. Escalating without verifying facts could cause reputational and legal harm. Terminating staff or studies prematurely is non-compliant. Question 19. Which of the following best describes the role of a compliance dashboard in global healthcare compliance? A. It provides real-time tracking of inventory and logistics. B. It serves as a clinical decision support tool. C. It enables senior leadership to monitor key risk indicators and program metrics. D. It assists in employee performance evaluations. Correct answer. C. It enables senior leadership to monitor key risk indicators and program metrics. Explanation. Compliance dashboard aggregates KPIs and KRIs, providing visibility into program effectiveness and emerging risks. Dashboards are crucial for proactive compliance management and informed governance decisions. Inventory, clinical, or HR tools are distinct and not part of dashboard compliance monitoring. Question 20. Which of the following is a key compliance consideration in mobile health mHealth applications? A. Offering free health advice on fitness tracking. B. Enabling data collection without informing the user. C. Processing personal health data with user consent and appropriate safeguards. D. Replacing in-person diagnosis with automated chatbot responses. Correct answer. C. Processing personal health data with user consent and appropriate safeguards. Explanation. Apps that collect personal health data must comply with GDPR, HIPAA, or applicable local laws. This includes obtaining explicit consent, informing users of data use, and ensuring data security. Passive data collection or replacing medical diagnosis with AI without oversight is high risk and often non-compliant. Question 21. In accordance with the UK Bribery Act, which of the following is a valid defense for a company accused of failing to prevent bribery? A. The bribe was culturally accepted and small in value. B. The company terminated the employee after the fact. C. The company had adequate procedures in place to prevent bribery. D. The company relocated its headquarters to a different jurisdiction. Correct answer. C. The company had adequate procedures in place to prevent bribery. Explanation. Under the UK Bribery Act, adequate procedures is the only statutory defense available for organizations. It requires demonstrating proactive, risk-based anti-bribery compliance systems. Cultural practices or post-fact punishment do not absolve legal responsibility. Question 22. What is the primary role of the OECD Anti-Bribery Convention in global healthcare compliance? A. To regulate clinical trial data transparency in Europe. B. To enforce anti-money laundering in health insurance markets. C. To combat the bribery of foreign public officials in international business transactions. D. To set hospital infection control standards. Correct answer. C. To combat the bribery of foreign public officials in international business transactions. Explanation. The OECD Anti-Bribery Convention is an international instrument focused on combating corruption in global trade, particularly bribery of public officials. It holds multinational companies accountable and is often referenced alongside domestic laws like the FCPA. Question 23. Ms. Farah, a newly appointed global compliance officer, discovers that several local country managers routinely accept cash honoraria for speaking at events sponsored by pharmaceutical companies. No disclosures or contracts exist. What is her most appropriate first step? A. Create retroactive contracts to document the payments. B. Report the individuals to local authorities. C. Conduct a risk assessment and initiate corrective training and disclosure. D. Terminate all managers involved without investigation. Correct answer. C. Conduct a risk assessment and initiate corrective training and disclosure. Explanation. Identifying systemic noncompliance requires structured response, risk assessment, education, policy revision, and disclosure. Immediate reporting or termination without due process may not address root causes. Retroactive contracts are noncompliant and may be interpreted as falsification. Question 24. Which of the following best defines the concept of tone at the top in healthcare compliance? A. Employee enthusiasm for compliance training sessions. B. Commitment from executive leadership to foster an ethical culture. C. Development of standardized policies for global operations. D. Using AI tools to detect potential compliance breaches. Correct answer. B. Commitment from executive leadership to foster an ethical culture. Explanation. Tone at the top reflects how senior leaders influence organizational culture. A strong tone supports ethical behavior, effective compliance programs, and internal reporting mechanisms. Tools and policies follow leadership commitment, not replace it. Question 25. Which of the following would be considered facilitation payments and are typically prohibited under international anti-bribery laws? A. Paying a fee to obtain expedited hospital discharge paperwork in a foreign country. B. Giving a gift basket to a patient upon discharge. C. Paying a toll to enter a government parking lot. D. Covering travel expenses of a clinical investigator attending a protocol meeting. Correct answer. A. Paying a fee to obtain expedited hospital discharge paperwork in a foreign country. Explanation. Facilitation payments are small payments made to expedite routine government actions. While common in some regions, laws like the UK Bribery Act and OECD Convention prohibit them regardless of size or custom. Legitimate travel reimbursement with proper documentation is permissible. Question 26. Under good clinical practice, GCP standards, which of the following is essential for ethical clinical research? A. Publishing results only if the outcome is favorable. B. Informed consent must be obtained and documented before any procedures. C. Providing subjects with financial incentives without limitation. D. Allowing investigators to modify protocols independently. Correct answer. B. Informed consent must be obtained and documented before any procedures. Explanation. GCP requires informed consent before study procedures begin. This ensures respect for autonomy, safety, and legal compliance. Undocumented consent, financial coercion, or protocol changes without IRB ethics review violate GCP principles. Question 27. Which of the following is the most appropriate tool for detecting patterns of potential fraud, waste, and abuse, FWA, in global healthcare operations? A. Annual patient satisfaction surveys. B. Internal hotline for anonymous whistleblowing. C. Data analytics and audit software to identify billing anomalies. D. Employee compliance self-certifications. Correct answer. C. Data analytics and audit software to identify billing anomalies. Explanation. Advanced analytics tools can flag outliers, duplicate claims, or patterns that suggest FWA. This enables real-time oversight and preventive action. While hotlines and surveys are useful, they are reactive, not predictive. Question 28. Which of the following would be considered off-label promotion under FDA regulations? A. Distributing peer-reviewed studies on approved uses of a drug. B. Educating physicians on new safety warnings added to a label. C. Marketing a medication for a condition not approved by the FDA. D. Training internal sales staff on label-approved dosing guidelines. Correct answer. C. Marketing a medication for a condition not approved by the FDA. Explanation. Promoting unapproved, off-label, uses violates FDA and international advertising rules, even if physicians may prescribe off-label. Sharing safety info or label updates is allowed if properly documented. Question 29. Dr. Ito is employed by a hospital system in Japan. A U.S.-based medical device company offers him monthly consultancy fees to recommend their products during surgical team briefings. No formal agreement is disclosed. What is the best compliance course of action for the device company? A. Proceed with the payments, as there's no U.S. patient impact. B. Require Dr. Ito to disclose the relationship internally only. C. Establish a formal consulting agreement, disclose the relationship and document services. D. Offer the consultancy through a third party to avoid transparency concerns. Correct answer. C. Establish a formal consulting agreement, disclose the relationship and document services. Explanation. Transparency, formal contracts, and disclosure are essential to avoid breaching FCPA, UK Bribery Act, or EFPIA transparency codes. Informal or undisclosed payments are red flags for bribery and conflict of interest. Question 30. Which regulatory agency is primarily responsible for enforcing healthcare-related anti-fraud activities in the U.S.? A. FDA, Food and Drug Administration. B. DEA, Drug Enforcement Administration. C. OIG, Office of Inspector General. D. CMS, Centers for Medicare and Medicaid Services. Correct answer. C. OIG, Office of Inspector General. Explanation. The OIG enforces fraud, waste, and abuse laws, oversees exclusions, and monitors CIAs, while CMS administers reimbursement and FDA regulates products. OIG handles audit and enforcement related to compliance.